Hello everyone, this is Rami Abu-Shasha. Today I'll be going over a visual representation of the common ophthalmic diseases that we see in the emergency eye clinic. This is an illustration that I drew of somebody in the audience watching a soccer game. We'll consider this as a normal image and then we'll go over several abnormal images. Compared to the normal, this first image shows multiple black dots and a curtain sensation or a curtain deficit in the top left corner. This is commonly seen in retinal detachments where patients will complain of a curtain defect along with many floaters and in some cases flashing lights. Now, in this case, the curtain defect is in the top left corner. However, it's important to remember that the area of retinal detachment would be on the opposite side. In this image, we see that the peripheral field has been lost, but the central field is preserved. And we see this in glaucoma, mostly in the end stage cases. Now, of course, glaucoma goes unnoticed for the longest time, but as it progresses and gets more severe, patients begin to notice that their peripheral field of vision has decreased. In this image, it's the complete opposite, where the viewer watching the soccer game has an intact peripheral field of vision, but their central field is affected. And so we see this in macular diseases, most notably macular degeneration. In this image, we see that there's a doubling phenomenon where the image is duplicated and the images are to the right and left of each other. And so we call this diplopia, but to be more specific, horizontal diplopia. We see the doubling phenomenon once again here, but instead of the images being to the right and left of each other, they are in fact above and below each other. And so we call this vertical diplopia. And of course, both horizontal and vertical diplopia correspond to cranial nerve deficits and other neurological problems. That concludes my talk on visual representation of common ophthalmic diseases in the emergency eye clinic. I hope you guys find this useful. If you have any questions or comments, please leave them in the comment section below. Thank you.